In late 2012, Glendale firefighter-paramedic Alex Sellers was sitting in the passenger seat of her sister-in-law's car stopped at an intersection. Her 7-month-old son Jameson was strapped in a car seat behind her. An SUV rear-ended her car, pushing it into the intersection where it was struck by 2 other vehicles. After climbing out of the sunroof, Alex tried to find her son in the wreckage. A bystander helped get him out. Her training took over as she assessed her son. He was unconscious, breathing irregularly, and his eyes were starting to swell. She began breathing for her son and praying for EMS to arrive. Peoria Fire, Sun City Fire, and Native Air responded. All of the agencies that responded to this incident were EPIC certified. Alex understood the importance of EPIC care before the accident, but her world changed in that instant her son was injured. Jameson suffered multiple skull fractures, 5 intracranial bleeds, and trauma to his spine. He was discharged from the hospital after an extended stay. It's unclear what the future will bring for Jameson, but EPIC pre-hospital care will give the best chance for a good outcome. Please remember to give EPIC care to all your trauma patients.
The reason why I wanted to get involved with the EPIC project is because my kid does have a brain injury and it has greatly impacted my family's life. And I think that the things that we do in the field, making sure our patients don't get hypoxic, making sure they're not hyperventilated, making sure that we keep their systolic blood pressure up, and checking their blood glucose and monitoring their end-tidal will have a huge outcome, and it's been proven to have a huge outcome on these patients and give them the best chance for a good quality of life.
I'd like to take the next few minutes and go over a new bag valve mask called the Smart Bag. There are a couple key things to the Smart Bag that helps us with some of the issues that we've had with standard bag valve masks on a regular basis. What we've noticed on regular bag valve masks is when you go to ventilate a patient, what will happen is you will either ventilate too hard or you will ventilate too fast. A standard bag valve mask when you ventilate is similar to this. When you do something like that, what you'll tend to do is you'll tend to fill the stomach up with air, which is not good for the patient, and you will also be bagging too fast, which is not good for the patient. What the Smart Bag offers us is it has this valve here that it will not allow you to bag too hard. So when you bag the patient, you just squeeze and it will not allow you to go too hard. That piece of the Smart Bag addresses one area. Another area that we want to address is the actual rate of our ventilation. And what this provides us is a lighting mechanism that helps us with the rate of ventilations per minute. When you pull this tab, you will see a green light. With the adult version of the timing mechanism, it will allow you to ventilate the patient 10 times a minute. This light will go every 6 seconds. What it does is it helps us when we're in the moment and we're bagging that patient. We have a tendency to want to bag too fast because we feel if we're bagging too slow, they're not getting enough oxygen. When in reality, if you're bagging them 10 times a minute, you're giving them the oxygen they need. You're not over bagging. That's what the timing mechanism affords us, is we're not over bagging. So when you're watching the light, when the light comes on, you ventilate. When the light goes off, you stop. Now, when you're doing that, you want to make sure that you're not pushing too hard on the bag because you'll feel this resistance when you do. You don't need to push that hard to get the proper tidal volume. If you do it at the right pace, you can actually get more air in than if you squeeze too hard. When someone uses the smart bag for the first time, and they're using the smart bag the way it should be, they get the feeling that they're not bagging fast enough. You get the feeling that you're under bagging, when in all reality, we're all used to hyperventilating when we shouldn't be doing that. So when you follow the rate, the light, and you use that in conjunction with your end-tidal CO2 monitoring device, keeping that between 35 and 45, and using those two devices and everybody on the scene to just keep an eye on you and looking at all your devices, you should be able to bag the patient at the proper rate. So we need to combine the whole package of end-tidal CO2, our monitoring device, and each of us policing each other, making sure we're doing the right thing for the patient. The setup is the same as with the adult version. You have your valve here. When the valve is not in the correct position, this is how you'll be feeling the bag. When it's in the correct position, it's similar to the adult version. When you want to activate the light, you take the tab and you pull it off. As you'll see, the light will come on. With the adult version, it's 1 every 6 seconds, okay, or 10 times a minute. This one is 20 breaths a minute for the peds. So, same format as with the adult, you bag during the duration of the light. So when the light comes on, we have a PEEP device that works with the bag. This is how it comes, and I will show you how we apply it to the bag itself. It has a sealing silicone seal here, and it comes up right over this section. We make sure that it's on there tight. It's correctly in place there. We have our bag, our face piece here, and the PEEP is connected here. Gives you your adjustment for PEEP on this side. And now you have your PEEP device secured to the bag. On the adult smart bag, it comes with a timing mechanism that it has a white background, as you see here. This one, it shows a red dot. The newer version is going to be a purple background. It'll also say PD ventilation timer on it. So you always want to make sure and double check that you have the right timing mechanism on your peds bag and on your adult bag. With each bag, there is a tear-off instruction piece right here that you can take off with you. Something we want to remember at all times is we're taking these patients and we're ending up at the hospital. And we want to make sure that the hospital understands that this bag is different than the standard bag they might be accustomed to using. The standard bag they're using, as we talked about, is this type of bag. The smart bag gauges our ventilations. So we need to let them know if they grab this bag and start bagging it normally, that's what's going to happen to them. We need to correct that and let them know that this is a different type of bag and it's not going to perform the same as what they're used to. It's going to perform better. And just because it may feel different does not mean there's a problem. If you're having a problem, what you need to do is pull it back and use it like a standard bag. And if there's no problem there, then the problem is you. You're not bagging it appropriately when it's in the correct position. So let's make sure when we come to the hospital and we deliver these patients, when they start taking over the bagging as they usually do, we need to make sure that they understand how to use this because it might be the first time that they saw the smart bag. I think what we've seen today is if we're using the proper bag on the proper patient, the way it's supposed to be used, utilizing our timing mechanism, utilizing our end-tidal CO2 and watching each other, we can really affect patient care in a positive way.